individual and that no state resources were used for his visit here today. With that, I would like to turn it over to our moderator, Andrew May. Andrew, please take it away.
Thank you, Kai. Thank you for that reminder. Ladies and gentlemen, members and guests, good morning. Welcome to another beautiful day in Port Angeles as we continue our debate forums. Today, we switch over to the only state referendum on your ballot. Citizens in the state of Washington are going to be asked a question if they should approve Senate Bill 5395, which will have sexual reproduction taught in our public schools. We're going to be debating the pro and con today. On the pro side, or voting to not have the Senate bill go through, is the senator from Washington, from Olympia, Senator Phil Fortunato. Senator Phil, welcome, please. I know you're one of the major forces in this referendum. And debating the opposite side is Dr. Grace Yellen. Dr. Grace, welcome, and please. Let's go over the rules of the debate. They're the same as the last several weeks. Each person will have 5 minutes to explain their position. After that, they'll have an additional 2 minutes to follow up, rebut, or add on to their arguments. From there, we go to questions, but we always have questions from members first. If time permits, others can type in. We put no limit on the answers, but we do ask that the two participants stay on the subject. With that, I'll go behind the mic and Senator Phil will start his 5 minutes. There we go, sir.
Andrew, may I make a correction first?
Please.
To approve this referendum is to keep State Bill 5395 on the agenda, not to disapprove it.
And that is correct. I misspoke. So would you like to mention that again? And I'm sure Phil will for all the audience. One more time, please.
If you're voting yes to approve referendum 90, you're voting to keep the state Senate bill as it was written,
yes,
not to take it off.
Yeah, very good. My mistake. And with that, Senator Phil, 5 minutes, please.
Oh, good morning. My name is Senator Phil Fortunato, and I am here to speak to reject R90. Now, what? And to clarify, sometimes when you have a referendum, it's a little confusing. To reject R90 means to reject the Senate bill. And so that means you disapprove of the Senate bill and you want it removed from state law. So currently it's passed, it's state law now. It's being held in abeyance until the R90 goes through. So if you vote to reject, you're voting to repeal that state law, which is what I am speaking in favor of. Now, much of the argument, I had some young people come into my office from Planned Parenthood. They were, 16-year-old, 17-year-old high school students, mostly female, come in and advocate for age-appropriate sex education. Now, nobody is opposed to age-appropriate sex education, but as with many things, the devil is in the details. And what exactly is age-appropriate? Well, what's age-appropriate to me is not what's age-appropriate to other people. In addition to that, one of the arguments is we are doing this to prevent sexual abuse of children. Well, we already have laws on the books to do exactly that. So if I can make a comparison between 1639, which was the anti-gun bill, and this, they are very similar in their approach. The 1639 was billed as school safety. It actually had absolutely nothing to do with school safety and had everything to do with affecting people's rights to bear arms. This is very similar. So here we are being sold a bill of goods that this is for prevent child abuse, this is for age-appropriate sex education, and it's actually nothing of a sort. It is to promote a certain agenda. Now, a primary theme of this approach is to promote the gay, sexual, transgender agenda. Now, I have absolutely nothing to do, no problems with people who decide to be gay or whatever. It's not for me to tell people how to live their lives. I just don't believe that it is appropriate in our schools to be pushing a certain agenda. If we could change just one word, and instead of saying we're going to push the gay agenda, we would change one word and say, let's push the straight agenda. Let's push the traditional marriage agenda. The other side would be screaming blue bloody murder. I just don't think that promotion of a certain agenda or a certain sexual preference has a place in our schools. So really, this is what I refer to as verbal camouflage. They use the English language, but it's a different English because the words mean different things. And so that is what we are talking about. We are talking about not protecting our children from sexual abuse because that is already state law and Aaron's law was passed in 2016. We are not talking about educating our children on sexual diseases. That's already been done for the last 20 years. That's already on the books. That's already currently happening. So what this is really about is a discussion, and what has people so outraged is when they go and they actually look at the information that is being projected or presented to our children and at what ages. And that's some of the things that I would like to discuss today. So thank you.
All right. Well, thank you very much, Senator Phil. And now, Dr. Yellen, 5 minutes, please.
Good morning. My name is Grace Yelland, and I've had the privilege of being a pediatrician for the past 33 years. I chose this field because I am absolutely in awe of children. Dogs come second, as Edna can attest to, but children are first in my life. Children start out as very loving, honest, and unbiased little human beings. I've recognized that it's their surroundings, which includes their family, their church, their culture, the media, that play such an important role in whom they become. This debate is about sex education. And I must say that I'm using no verbal camouflage, and I never use verbal camouflage in my office. While I believe children should primarily receive their sex education from their family, it's very obvious from my clinical experience that their education is incomplete. This is not to fault the parents. My husband and I have raised 2 wonderful, successful children, but at times, but at times we were blindsided by what they saw and heard from friends and the media. Most parents don't have degrees in early childhood education. The risks of, I encourage, but they do their best. Most parents don't have this training, but they do their best. I encourage parents to talk to their children about their changing bodies, their school crushes, their dating, the risks of sexual activity, and yes, even the dangers of child sexual abuse. In an ideal world, we would not need this instruction in the schools, but we live in an ever-increasing sexual society. Look at billboards advertising clothing, just to get my point. Senate Bill 5395 and approving Referendum 90 will give our children the tools they need to be safe and healthy. What does this curriculum include? It is age-appropriate information for all children in public schools, and I stress age-appropriate. Individual schools with the input of the school superintendent, teachers, health experts, and parents can specifically design it. So this isn't somebody else's agenda, this is our agenda. And I stress that it's age-appropriate. In grades K through 3, this will not include any sexual content. I repeat, it will not include any sexual content at all. It focuses on social emotional learning. This is a process where children learn to recognize and manage their emotions, set goals, learn how to make proper decisions, responsible decisions that support their success in school and in life. This social emotional learning will give children experiencing abuse the tools that they need in order to get help. It gives them the language to get help. Young children who are being abused often don't understand what's happening until someone provides them with these tools. In the home, parents should be talking to their children about good touch and bad touch, and I'm sure they do, but that is not going to guarantee that it won't happen. Unfortunately, 34% of child sexual abuse cases occur before the age of 12. And I believe 89% of the perpetrators are somebody who is known to the family. These children urgently need these skills now. In grades 4 through 12, the instruction includes physiological, psychological, and sociological development. What do all these fill-in-the-blank logical words mean? It means what kids are going through with their changing bodies, new feelings, and new ways of interacting with society. A comprehensive sexual health education would teach them to choose healthy behaviors and enter into relationships that are based on mutual respect and affection, relationships that are free of violence, coercion, and intimidation. Yes, it will emphasize abstinence as the only 100% effective method to prevent pregnancy and STIs, meaning sexually transmitted infections. This is a given. I counsel my teen patients about abstinence as the primary method of preventing these problems. But I would be foolish to believe that that is going to be 100% effective. So I am giving my patients the tools that they need to make better decisions, enter into healthier relationships. Reputable studies have shown that comprehensive programs actually reduce the rate of sexual activity and high-risk behaviors. It reduces the rate of STIs and adolescent pregnancy. Programs that emphasize empowerment and gender equality lead to teens who use critical thinking, make better and healthier choices. So this program will emphasize affirmative consent. Think about the recent explosion of the Me Too movement lately. I think we need to empower our children with these tools so that they can be healthy throughout the rest of their life. Thank you.
Thank you, Dr. Yellen. And now Senator Phil, would you like to take up to an additional?
Sure. Well, I would like to respond to that. I don't think anybody disagrees with what she said.
Thank you.
That's not what we're talking about. So let me ask you this. Let me emphasize age-appropriate sex education. Kindergarten lesson 2. Correctly identify at least 3 body parts of female anatomy: nipples, vulva, and anus. Correctly identify at least 3 body parts of the male, namely nipples, penis, and anus. Describe why is it important for them to know the correct names of the genitals. Now, kindergarten, 5 years old. Most girls have a vulva. Most boys have a penis. Does anybody know a girl that does not have a vulva or a boy that does not have a penis? Now, this is what we are talking about in kindergarten. And that is the focus of this bill, to allow this. Now, I believe, for example, that parents have the right to affect change. That means a parent who objects to a sex education program should go to their local school board and voice their objection and have the ability to affect change. That's not what happens here. The school board has to adopt a sex education plan that is approved by the superintendent of public instruction. So all of this stuff has to go through the superintendent of public instruction to be approved. And if it doesn't contain this stuff, this is right out of their own lesson plan, K through 12 curriculum. And you can get that from Informed Parents of Washington. They have the whole thing all laid out for you. I suggest you go there and download it and look for yourself.
Okay, thank you, Senator Phil. Dr. Yellen, 2 minutes if you would like.
Thank you. There are a few things I'd like to comment on, Dr. Fortunato. This bill that has been passed already in the referendum that we're voting on to approve it is designed to allow individual schools to come up with their own curriculum. So the curriculum that you read from does not necessarily mean that's going to be what happens in our school. Number 2, I stressed at least twice in my opening comments that there will be no sexual content between kindergarten and age 3. So that is still the case. That is written into this law. Talking about where your nipples are, what's a vulva, what's a penis. These are things that we talk to our 2-year-olds about. We talk to our 1-year-olds about. We want to teach them proper anatomy, part of this is because they're human beings. We should trust that they can absorb this information. We don't want to call personal body part your hoo-ha when nobody knows what do you mean by your hoo-ha. If somebody is being sexually abused, me as a medical provider, I want to know, okay, well, what part of your body was inappropriately touched? And if this child is saying, well, my patootie, well, what's your patootie? That's why these children need to know that information. So again, I would stress that the curriculum is going to be designed by our schools, our superintendent, our teachers, our parents, our health educators, our community health leaders, not by somebody who feels like we should be talking to children in very vague sexual terms. So that will not be happening.
Okay, if I can respond to that.
Actually, so what we'll do is, I'm going to go to questions, but you know what? Respond to that.
It's not correct.
Why is it not correct?
It's not correct because, again, the curriculum has to be approved by the superintendent or the superintendent of public instruction. And so we went through all of this stuff. Current law says you have sex education, it talks about sexual abuse, it talks about appropriate touching, it's already current law under Aaron's law. So that's already taken care of. We also have the sexually transmitted disease. That's been going on for 20 years. And I actually went to that when my daughter was 12 years old. And the part that I objected to was, if you're an average teenager and you're having sex twice a week with 2 different people, and they're having sex twice a week with 2 different people, and they do this little pyramid thing. Now, and I said to the teacher at the time, are you out of your mind? Do you want to tell my 11, 12-year-old daughter that she's not average if she's not having sex twice a week with 2 different people? So the question comes in is, I have no problem with any of this stuff. You want to teach our kids sex education and you want to have them use proper body parts, send a notice back to the parents every month, every quarter, whatever, and say, this is what you should be discussing with your child. Do you want, and I'll be honest with you, I have teachers coming to me complaining, I don't want to teach this stuff. I don't feel comfortable teaching this stuff in my classroom. I don't want to be held responsible for some of the things that this may lead to. So here you have educators. Now, there's some educators that are falling all over themselves to teach this. Other educators object. So I just think this is a parent's decision to be able to talk to their children. And this is not about sexual abuse. This is not about educating our children about sex. This is about promoting a certain agenda and promoting a certain curriculum that has to be approved by the superintendent of public instruction. So your school board is going to come up with a curriculum, send it to the superintendent of public instruction for approval, and if it doesn't have certain things in there that they think is appropriate for your child, it gets rejected and they have to redo it. So the ability of a parent to control the curriculum is limited and without the oversight of superintendent of public instruction.
Dr. Yellen, is there an agenda in this bill? And if so, what is it?
The main agenda is to raise healthy kids that know how to make good decisions, that enter into relationships with open eyes, that know what they're doing. They need to be morally mature, mentally mature, physically mature to make good decisions. So the agenda of this bill is very, very explicitly to raise our children with that in mind. The agenda is not to promote LGBTQ values, but it will include treating all people as equal, as every person is worthy of their respect. I don't believe this agenda will go into very specifics about gay sex. That has nothing to do with this. The parents do have an input. They have a 100% option of opting their children out of this program. So yes, the curriculum that is designed has to be approved by OSPI, but it does not mean that you have to include every little detail that different factions of the community want to put in. So this can be an individualized program.
So if I may.
Please.
off of NARAL pro-choice, Washington. SB 5395 requires all school districts to offer medically accurate, age-appropriate, comprehensive sex education that is LGBTQ inclusive.
Exactly.
Okay, so one of the books that is promoted for fourth graders, now fourth grade is what, 9, 10 years old, is It's Perfectly Normal. So it's perfectly normal to have a gay relationship. Now remember, this is a 9 and 10-year-old. Now, we're not talking about whether it's appropriate to have a gay relationship or not. We're simply talking about whether it's appropriate for a 9 or 10-year-old to be taught that. Now, if we turned around and we said, you know, we want to promote a straight sex, and we would call a normal relationship, and we would promote the traditional marriage, people would be screaming blue bloody murder that this was anti-gay or whatever. So that's not what we're talking about. 9 or 10 years old, if you're talking about age-appropriate sexual stuff, I just don't think that bringing that up, straight, traditional marriage, whatever, I just don't think it has any place in our school system.
Do you think then that there should be any discussion with 9 and 10-year-olds about what you would call straight?
I mean, why bring that up at all?
Okay.
I mean, if what we're talking about is sex education, we're talking about preventing child abuse, and we're talking about preventing sexually transmitted diseases, we want to be emphasizing appropriate touching, which again is already state law, and sexually transmitted diseases, which again is already state law. Those things you can say to appropriate areas of your body that people should not touch. You don't need to get into the medically accurate stuff. You should say, if somebody's touching you in an inappropriate area, private areas of your body, you don't need to get into what the exact medically accurate terms are. A child could go to a doctor and say, I was touched in a private area of my body. And that would communicate you know, exactly what happened. And you don't need to get into all this stuff, which again, I don't feel is appropriate at certain kindergarten, 5 years old. I mean, I just don't think it's appropriate.
Dr. Yellen, I continue to hear about this in discussions, always this, what is appropriate, how young? Do you care to expand on that? What is your opinion?
I would care to expand. Thank you. I think Senator Fortunato does not give children enough credit. They're very intelligent. They are very aware of what's going on around them. They pick up on others' emotions. They pick up on the media. And you would not believe what 9 and 10-year-olds tell me when I ask them specific things in the office. Unfortunately, the media has made us be a much more hypersexualized society than I feel we should be. I am working with other people to try and change that, to kind of put a spin on it, you know, what is healthy and what is realistic. We teach children to be critical thinkers. I did a program called Tar Wars in elementary schools where we talked about looking at cigarette smoking and advertising in cigarette and be a critical thinker. You know, why does this picture show these very happy, well-dressed, beautiful people with pearly white teeth smoking cigarettes when we know that smoking cigarettes causes your teeth and your fingers to turn yellow? So children are hearing about sex in the media. They're hearing about it from their parents. We have to give them the skills to learn how to deal with this. So Senator also said, you know, why is this appropriate to bring up gay relationships or straight relationships? Well, what about the 9-year-old whose parents are 2 gay men? What about the child who has friends who have 2 gay mommies? They know about these relationships. And so it is doing us a great disservice to call this abnormal or to make these children feel like something is wrong with them.
And again, if I could respond.
Well, what I'd like to do, because I want to get to members' questions, and this is going to really drill down on the subject we're talking about a lot more. And this comes from Jim McIntyre, who is a former county commissioner. He serves as our organization's business affairs chairman. And Jim asked, I think I understand that sex education legislation is required separately and is not part of this bill. and sexual health education is already happening. There are no findings in this bill. So what was broken in sexual education that this bill fixes? Why do family conversations not work? And we'll start with Dr. Yellen. Again, the question is, what is broken that this bill needs to fix? Why aren't conversations at home good enough? Dr. Yellen.
I wish that conversations at home were good enough. As I mentioned, my husband and I have raised 2 kids. We've tried to have these conversations with them. Most of the time they took what we had to say with open ears, and other times they were like, Dad, I don't want to hear about it right now. So there are many parents who don't have the tools, they don't have the words, that maybe they grew up in a sexually abusive household themselves. Maybe they're in a marriage where there is domestic violence. So these parents may be struggling with ways to talk to their children about sex, about relationships, about healthy relationships. So what's missing in the schools right now? Well, as it is right now, the schools are required to talk about HIV and AIDS education. There may be some talk about good touch and bad touch, but this is not inclusive in all schools. It's not inclusive in all public schools. There certainly is not an agenda or a program talking about choosing healthy relationships, basing your relationships on maturity, on mutual respect. Our children need to learn these skills in our society, not just in a relationship with a partner, a sexual partner or a romantic partner, but in all of their lives. They need to learn how to be respectful to their boss. They need to learn how to communicate with coworkers. They need to navigate the world of higher education. So we're giving them tools in this comprehensive sex education that will allow them to be a lot more successful in all areas of their life.
So if I could chime in.
Yeah, oh, you absolutely, please.
Okay. None of that has anything to do with what we're talking about. Because all of that stuff, nobody disagrees with what she just said.
So then the question is, and remember, let's go to the question. It was, what was broken that you think what do you think, being in the legislation they were trying to fix, and why do you think conversations in the family work?
We have to focus on what we are actually talking about here. Remember, we are talking about what they want to teach our children. So the question comes in is, everything that she just said, I don't think anybody disagrees with that.
But once again, Senator Phil, let's stick with the question. So are you saying that what the legislation thought was broke is not teaching a gay agenda? Is that
Well, let me ask you this. 5th and 6th grade, have the children draw a gay pride flag. Now,
again, I want to stick with our member's question though. So I'll ask it one more time. There's no finding in these bills. So what was broken in sex education? What do you think they were trying to fix? And why do family conversations work, in your opinion?
And again, this sort of ties in together. You're asking me what was broken. We already have STD training that's been going on for 20 years. We already have Aaron's Law that addresses sexual abuse, inappropriate touching, and all this other kind of stuff that what she's concerned about, children being abused, children coming from broken households. That's already been done. What exactly does this do that we haven't been already doing? And the question comes in is, when you go look, you see that this constantly promotes this alternate agenda. Now, the alternate lifestyle agenda. I believe it is appropriate. All people deserve consideration. All people deserve respect. And I just don't think that this should be taught by somebody outside the family. This is a parent's job. And if you want to teach your parents certain things that are in this curriculum, you should be educating the parents. You should be once a month, send something home with your parents and say, you should be discussing these things with your children. Do you want an outside, you have no idea what is being taught to your child unless you actually go through all this curriculum. And you have to sit there as a parent and go through this stuff and say, do you think it is appropriate to walk in, this is a procedure, this is in the curriculum, walk into the room and hold up a wooden penis model or a banana and say, this is the day, and tell students how to put condoms on. Do you want a teacher walking into a classroom with a wooden penis and putting a condom on a wooden penis? I mean, this is what is in this agenda or this curriculum. Now, whether or not you believe that that's appropriate, I believe that that is a parent's decision in order to educate their children. And if the school board thinks that this is something you should be doing, you should be educating the parents to, at this age, you should be talking about this with your children. You know, children are sexually active. We have information that they become sexually active at puberty, 13, 14, 15 years old. They should be knowledgeable about this stuff. Educate the parents to do that. Okay, this is not something that, first of all, again, we have teachers that object to this. I don't want to do this in my classroom. I don't think that this is appropriate. So that's not only me, that's not only other legislators. I mean, when I was on the Senate floor, I was going to read from one of the curriculum items, and I was going to stand up and read. They actually did this in the House because it was 1:30 in the morning for them, and they had a TVW put on their sexually explicit material content, and I was going to read from that, except it was like we were in the afternoon, and a bunch of fifth graders came into the gallery. And I stood on the Senate floor and I said, I was going to read this, but I don't think that it's appropriate to read this with children in the gallery, even though it is from the same curriculum, age appropriate for these children. I just don't feel comfortable talking about it on the Senate floor.
May I chime in?
Oh, please, absolutely.
So I totally agree that parents should be talking to their children about these issues. But may I remind you that the kids that we are trying to educate in school are going to be future parents. So we are giving them tools to be better at discussing this in the future when they have their own children. I think that's super important to understand. And again, parents have the opportunity to opt out of their children receiving this curriculum at any time. So I'd also like to continue answering the question, what's broken in our current program? Well, what we're talking about right now is we're trying to introduce comprehensive sexual health education, as opposed to what happens now, which is teaching abstinence only. So there have been many studies that show that in schools where abstinence only is taught, there's a much higher rate of teen pregnancy and birth rates, even after accounting for socioeconomic differences, teen educational attainment, ethnic composition, and availability of insurance and access to family planning services. Also, abstinence-only curricula do not address inappropriate touching, sexual abuse, and harassment, and how to recognize a safe relationship based on mutual respect.
Anything to add, Senator Phil?
Okay, so opt out. You can opt out. Everybody talks about the stigma we're putting on our children and this and that. We brought up the fact that if you are perhaps a religious family and you decide to opt your child out, and your child is the only one in that class that gets opted out, is that a stigma attached to that child? We had an amendment, simple amendment. You want to run this stuff? Fine. Have parents opt in. What's the objection to that? If you are a parent and you think this is great stuff, opt in. Put your kid in that class, right? You agree with the agenda, you agree with everything they're doing, let the kid opt in and all that, and you don't have a problem. What was the big, gigantic objection to opting in as opposed to opting out? So we talked about abstinence only. I'm going to read something from Janet, mother of an advocate for this. This is from the NARAL site. I opted my children out of sex education at school because it was for abstinence and talking to my children about sex when they were older. Then my daughter, 15, told me that she had been sexually assaulted by a very close family friend when she was 8 years old. I realized the importance of comprehensive sex ed because it has given her the tools to come forward earlier. What? How is promoting abstinence only not allowing that child to come forward sooner? I don't understand the connection there. Because again, we have Aaron's Law already on the books. We have all this stuff that's supposed to be taught to our children to give them the tools that they need. Mom, Uncle so-and-so touched me in a private area. That's all the tool an 8-year-old needs.
I think Dr. Fortunato, I'm sorry, Senator Fortunato just boosted up voting to approve Referendum 90, because that child does need the language and the tools to report sexual abuse. Just last week, I had a child come into my office. She was a teenager. She was 16 or 17 years old and struggling with a lot of emotional problems. And her mom said that she had just told her that between the ages of 8 and 12, she was being abused by a family member. But this teenager did not tell her mom until she was 16 years old, because she did not know that this was something that she could do without incrimination. She did not have the language to do this. In my own family, there were instances when I was a child when I saw something uncomfortable happening, but I didn't know that I had the power to say something to my parents. I didn't know that this was something that I really needed to stand up against. I felt bad. I knew something bad was going on, but I didn't have the tools necessary. So if I had had that education in kindergarten, first grade, second grade, then my family member who was being abused would not have had that happen. So I feel very strongly that we do need to give children these tools. It's not a given. And abstinence only does not do, talking about abstinence only and being a parent who's doing a great job talking to your children about sex in the home from a very early age does not mean that they are not going to be sexually abused. It's not exclusive.
And what I'd like to do, if I can get to another question, because again, I think it's moving on this subject. Let's see. Thank you both for coming today to address this topic. If I understand correctly, the comprehensive sex education will not be a single class, but will preeminate multiple subjects in school. Can you speak to that? Secondarily, the questioner wants to know about the opt-out. How does that work when students will speak with one another about the subject outside of class? So let's start with Senator Phil. Can you speak about how this is supposed to work through all the different disciplines in the school, and how does one go about opting out?
So, well, I suppose I'm not familiar with the opt-out process other than you simply, as a parent, say, I opt out. You notify the school and say, I opt out of this program. But you can, again, go to Informed Parents of Washington and download the entire curriculum where it goes through kindergarten. This is what you should be teaching. And at the end of second grade, they should know this. And it goes through the entire curriculum. And this is the base curriculum that you are supposed to model your local curriculum on. And if it doesn't meet those requirements, it comes back from the superintendent of public instruction. It comes back to the school district to modify their curriculum to meet those certain minimum requirements. So again, this takes away a parent's rights to influence their local school board's decision. So one of the things that gets me is if you go into a local school board, for example, and you complain about something and they say, well, what do you want me to do? It's state law. I can't do anything about it. It's state law. You go to your state law and they go, well, what do you want us to do? It's Congress. So now you have less and less influence. This stuff, if you want this, I have no problem whatsoever with your local school board implementing all of this stuff. Parents go to their local school board. Parents say, we approve this agenda, and the local school board does it, fine. If that's what the local community wants, and you have the ability to opt out or opt in, and the local school board determines that, fine. We're not talking about giving kids the tools to discuss sexual abuse. That's already being done. We implemented that a couple of years ago. It's already being done. So all the future kids will have the tools they need to report sexual abuse. So that's already state law. We don't need this. And the question comes in is, again, this infringes on a parent's right to determine what they're educating their children on. And you want to do this stuff, you think it's important, Send it to the parents and say, you should be discussing this with your children. But again, we talk about the stigma of stigmatizing our children, gay, transgender, this, that, and all this other stuff. And what about the stigma of the kid that opts out? Are we stigmatizing that? Oh, here's what the Planned Parenthood calls people that object to R90. Extremist groups want to reject Senate Bill 5395. So a parent that thinks this is not age appropriate is an extremist group? What about the stigma of the parents that opt out? Are they extremists? Are they radical Christians? Are they, what is that? So opting in is a much better approach.
So let's find out, are the groups against it extremists? And let's get back to the question though too, which is not only how is it integrated in other classes, but even if someone wants to opt out, won't that discussion happen? And how does one go about opting out?
Well, the curriculum is not integrated into all the other classes. The curriculum, according to this Senate bill, says that instruction would need to be provided at least once to students in grades K through 3, once to students in grades 4 to 5, twice to students in grades 6 to 8, and twice to students in grades 9 through 12. Sexual health education would not be required to be integrated into unrelated subjects or courses. So there it is in the facts. How do parents opt out? They can review the curriculum at any time. They can review it before their child enters school. They have an option to opt out just by asking the school to not have their children be part of this up to a month before the class is going to take place. So it's not difficult. I don't believe it's going to be stigmatizing. There may be quite a few children who are opting out. I have parents that opt out of my talking to their children about sex. You know, I've been chided on several occasions because I've brought up this issue with their children, and I've been told that it's not my place to talk about this, and I have to explain it is my place to talk about depression, about bullying, about STDs, about unintended pregnancy. Many of these parents who are chiding me do not know that their children are sexually active because they've gone behind their parents' backs to get birth control. So I don't think that's a good idea to go behind their parents' back, but I'm glad that they're taking charge of their health. So opting in, I think that's an interesting option. And I believe that opting in would be almost the same thing as just requiring it for everybody. There was a study in the Journal of Adolescent Medicine that showed that a very large majority of parents, 89.3%, support teaching both abstinence and contraception in the schools. Parents believe that most of these topics should be taught in the middle school years. So this is scientifically proven fact that parents do want this information to be taught in the schools.
Senator Phil, it looks like you have something to say.
You know, I did a PowerPoint that I sent for you to show. I feel extremely uncomfortable actually putting the PowerPoint together. I don't know whether you want to put that on your webpage for people to download, but it's actually, you can go to Amazon and look at a book that they are suggesting that is included as a teaching aid for 4th grade. So what's that, 9 years old, 10 years old? The book is called It's Perfectly Normal, Changing Bodies, Growing Up, Sex, and Sexual Health. Shows graphic pictures of people having sex, shows graphic pictures of young people pleasuring themselves through masturbation. I guess, do you feel comfortable having, and there's various pictures of, well, you know, again, I feel uncomfortable. But you can go on Amazon and look at the preview for the book and determine for yourself whether you want your 9-year-old to be taught this. We are not talking about anything that she just said. Nobody disagrees that our children need to be educated. They need to be educated on how pregnancy happens and things like that. What we are talking about is the graphic representation of this supposed curriculum. Now, it says comprehensive sex ed has to be included, has to have LGBTQ stuff. Why? I mean, if we're talking about preventing pregnancy and we're talking about sexual abuse, that can be done without graphic representations and basically stealing our children's childhood. And again, I just think that parents need to be looking at what they say the agenda is. Go to Informed Parents for Washington, download the entire curriculum. They have little notes in there and everything. Great job. It'll tell you what they want to do. And when she says it doesn't have to be integrated into the local, all the other classes, what that means is, well, sex ed won't be integrated into math class. And when, oh, it has to occur once or twice, but there are specifics things that need to be attained at the end of each class. By the time they're at the end of their second grade, they need to know this. So they need to integrate all of that stuff and have a program that educates the children to know a certain block. And if your curriculum doesn't do that, they have to do it as much as possible to make sure those kids know this stuff. Now, again, we're not talking about preventing sexual abuse, already done. We're not talking about sexually transmitted diseases, already done. We're not talking about preventing pregnancies or abstinence only. Hey, local school board decision. If you think that that's appropriate as a parent, you should be able to go to your local school board and you should be able to affect change. And if you can't do that, that's not a good system. And that's what this does. Your ability to affect change is limited.
So let me ask, and then Dr. Allen, I see you want to have a response, but I'm going to ask a moderator's question, maybe following up on this. And it's going to be slightly different for each of you because I want to get into your mindset. So to start with Senator Phil, what do you think is like the bare maximum? What are the things that the school should be teaching to students about sexual reproduction and relationships? What is the bare?
Present this in a, you know, what they want to portray is this curriculum.
But once again, Senator Phil, I'm not asking what they want to portray. I'm just trying to get into your mindset. What do you think is a bare necessity, if any, to be taught about sexual reproduction?
Well, that's what I'm saying, is they want to say that this is medically accurate, okay? It has to be medically accurate. Well, I mean, is it medically accurate to go through the biological process? This is what happens. The sperm interacts with the egg.
That's what I'm asking you. Is that you think that's somewhere along the line?
Well, I mean, so you could teach the biological process. You could teach how this happens. You could teach that, you know, at 14 years old, a girl's body changes. I don't know if you recall when I was a kid, boys went in a room and you got to talk. Girls went in a room, they got to talk. Do you think that it's appropriate to get to talk in a co-ed situation? I don't think so. I mean, you know, girls' bodies change differently than boys' bodies change. And so that information can be communicated with strictly a biological approach and say, this is what happens, this is how biology works, this is what happens. And in order to prevent that, this is something that you can do.
And do you think that there's a class or an age that's appropriate for that to start?
Pardon me?
And you feel that there's a class, grade, age where that should start?
Well, when the kids start hitting puberty, 13, 14 years old, their bodies are changing, their hormones are raging. This is one of the reasons why I sort of object. You know, some of the school districts have a gay and lesbian awareness day. Now, why don't they have a traditional marriage awareness day? I mean, if you said that, people would go nuts. And I just don't think that it's appropriate for school districts to be promoting that as a, you know, an awareness day and all that stuff, a school-sanctioned activity. Now, are there gay parents? Are there children that may lean in that direction? Okay, but having the school district promote that is a different situation. And so, does a 13, 14-year-old, when their hormones are changing, their bodies are changing, they have no idea what the heck is going on, you know, and you're trying to tell them, oh, you might be gay, you might be straight, you might be this. Why is that even in school? I mean, we shouldn't even be discussing that kind of stuff. You should just be discussing the biological functions. A girl's body changes. This is why it changes. That's all biology. This is what happens. This is how it works.
So
Boys'
that's-
bodies are changing. This is what happens. That's how it works. I mean, that could be done in an age-appropriate situation.
So let's find out from Dr. Yellen, the reverse of the question. What is the least amount that public schools should be teaching students about sexual reproduction and about relationships? The least amount.
That's a hard question to answer because we can't necessarily separate what the school is teaching from what other education kids are getting. If you look at internet porn, that is extremely, so much more graphic than having a wooden stick and learning how to put a condom on this wooden stick. So these kids are being exposed to internet porn the very first time they get a cell phone. And whether or not they are looking at it, their friends may be looking at it. The average age of looking at internet porn for a child is under the age of 12. I mean, this is a scary thought. So these children are receiving graphic information, like it or not. So I think that's why it's most important for us to kind of set them straight. Like what you see in pornography is not how relationships should be handled. It is not how sex happens. It is not real life. So again, we're arming our children with critical thinking. So again, just to comment on what Senator Fortunato is saying, I don't think the school is promoting a gay versus a straight agenda or ignoring the straight agenda or ignoring, you know, certain orientation. But what the school is promoting is acceptance, learning how to live with diversity, learning how to respect and give dignity to every human being, no matter what their background is, what their color of their skin is, what their religion is, who their parents are, and what their sexual orientation is. So what is the minimum that schools should provide? They should provide all children with scientifically correct information. They should provide them with enough language and tools to know how to be safe in any environment, safe in their own home, safe in the dating world, safe when they're looking at pornography, safe when they're looking at cartoons. I mean, look at what are they called? Superheroes. You know, why do all these superheroes that are women have to have humongous bosoms? You know, why do they all wear mini skirts? You know, we are hypersexualizing our society unnecessarily. So I believe the school has to be comprehensive in talking about these issues, the media influence, not just saying, okay, you know, for a baby to happen, a sperm has to come in contact with an egg. Well, my son, when he was 5 years old, was looking at a picture of a cross-section of a pregnant elephant. And he leaned over to me and he said, "Mom, I understand about the sperm and the egg, but how does the man give the sperm to the egg? Does he just hand it to her?" And, you know, at 5 years old, I started to explain, well, Jamie, you know, sometimes your penis gets a little hard and, you know, when parents cuddle really close, and that was all he needed to hear. At 5 years old, he was not going to absorb any more information. He didn't want any more information. So we're not asking the teachers to tell a 5-year-old, you know, that this is your clitoris and this is responsible for female orgasm. No, not at all. There's no sexual content in grades K through 3. But what we are trying to teach them, the minimum, is how to be safe. And Senator keeps saying that this is already in the schools. Well, it was not in the schools when my kids were in elementary school. I don't hear children that come to me in my practice saying that they've heard any of this. It's a standard on our question for well child exams. Does your child know the difference between good touch and bad touch and, you know, their private parts? Do they understand that these are private? Most of the parents check no on that. So I think it's obvious that this is not happening in school. And again, not to fault the parents. It's an extremely difficult job to be a parent. And so again, educating these children in school, I'm hoping that we're giving them tools so that when they are parents, they will be better armed.
There's a question in, I'll ask each just to give the audience maybe an idea. Is there a consensus among medical groups on the issue? Do mainstream medical or pediatric groups support or oppose this? What about parent groups? So let's start with Senator Phil. First of all, do you have a list of folks that are opposed to the Senate bill as far as groups in Washington?
Yeah, I had that list. Let me see if I printed it out. I must have missed it. But basically, Family Policy Institute, Western Catholic Conference, Informed Parents of Washington. There's 2 or 3 other groups you can, in support or oppose.
That's the opposed.
Yeah, where the heck is it? Catholic
Senator
Conference.
Shelley Short.
Yeah, well. But anyway, I mean, people could go, and again, the Informed Parents of Washington is a really good webpage. It has a lot of this information. Again, I just keep going back to when she says there is no sexual stuff included, just print out the curriculum and look. And it's not promoting an agenda. Teaching 5-year-olds the name of reproductive organs and sexual body parts is not necessary to keep them safe and contributes to early sexualization. So, I mean, this is a parent's role. My princess boy is 1st grade. So what's that? 6, 7 years old? You might want to ask a question, what might make a boy decide not to put on toenail polish, even though he wants to? I mean, why is that in a comprehensive sex education thing? So we are, I believe, when I look through this curriculum, as opposed to giving them the knowledge and the tools they need, I believe this simply adds more confusion. Her son said, how does the egg get to the sperm get to the egg? Well, that is her child asking that question. She's the parent. She gave them the information that she thought was appropriate. Do you want a school teacher or someone else telling your child graphically things that he may not be aware of? He may not want that information or ask that question. Kids are inquisitive, kids are knowledgeable, kids do this stuff. But again, what is age appropriate for one kid at 5 or 6 years old? Maybe kids, you know, my kids were, each one of them had a different talent. Each one of them had a different perception of what was going on. Each one of them asked different questions. So why in the world would you trust that to the school district as opposed to you, the parent? And when we come out with this, some parents may not educate their children. So a small group of parents, we need to pollute the entire system in order to get the 2 or 3 parents that might not be communicating to their children with what somebody else thinks is appropriate. So
let's go to Dr. Yellen, go back to the question. And the question is, are there Main Street medical or pediatric groups or other related groups that support this bill?
Well, first of all, I'd like to finish Senator Fortunato's answering the question because he did not talk about the groups that are opposed. So Washington State Senator Shelley Short says, what's affirmative consent when you're a kindergartner? We want students to be safe, but this is misguided policy at its very core. Well, affirmative consent when you're a kindergartner is recognizing that this is not an okay touch. This is somebody who is using force because they're my parent, they're my uncle, they're a teacher, they're my priest. There's somebody who is doing something to me that I don't feel good about, but he's telling me I shouldn't tell anybody, and so I need to trust this person. So affirmative consent when you're a kindergartner is preventing this type of horrible abuse. The Washington State Catholic Conference also opposes this referendum. They state, the law requires affirmative consent curriculum defined as a conscious and voluntary agreement to engage in sexual activity as a requirement before sexual activity. This requirement is not in accordance with church teaching that sexual activity be reserved for marriage. Parents can opt their children out of classroom instruction, but they cannot opt them out of schoolyard discussions and the culture change that may take place at school. Well, my answer to this is there may be sexual coercion and sexual abuse and assault within a marriage. Unfortunately, that happens far too often in our society. These children can opt out without the stigma of knowing that you're the only child that can't go to sex ed class. Having been raised a Catholic, I couldn't eat meat on Fridays. So if a friend would say, well, how come you can't eat meat? I can eat meat. I could say, well, they expect something a little extra from Catholics. So the children whose parents want to opt them out of this discussion at school can say, well, in our faith, this is what we believe. And so this is something extra. This is a special reason why I don't want you there. So that child can feel good about being singled out. Parents for Safe School also reject Referendum 90. They want to stop the early sexualization of our kids. Well, I hate to tell you, it's happening all over our society. Just look at media. Look at, I mean, these children, they're worried about schoolyard discussions tainting the children with knowledge that maybe they don't want to have yet. They are seeing that on a television show. I mean, if you want to learn about sexual positions, you know, turn on the TV.
And there's a list of folks that, some organizations that support those.
Yes. As a pediatrician, I can vouch for all pediatricians. I can vouch for the American Academy of Pediatrics. The American College of Obstetricians and Gynecologists are very much in favor of providing medically accurate knowledge to children that has been proven to reduce the risk of teen pregnancies, of STDs, of health complications related to both of those. I mean, teen moms, teenagers who become pregnant, they have a much higher risk of complications throughout their pregnancy. There's a much higher risk of anemia, of preeclampsia, which is a condition where their blood pressure skyrockets, they could die from a seizure. Their babies are much more likely to be born prematurely and have low birth weight and have risks for learning disability, behavioral problems. So I counsel my teenage parents who come in asking for birth control, well, first of all, are you ready to enter into this very psychologically heavy form of relationship? And if you are, then these are your risks. So these are things to think about. So these kids are hearing the discussions, not just in the schoolyard, but everywhere. Other groups that are in support, there are many of the Planned Parenthood associations, sexual violence associations are in favor of this because it has been shown that in schools where there is comprehensive sex ed, there is less sexual violence.
And as mentioned, I'm sure that there's a plethora of information that one could go to on this. So please.
Said it was being taught, but it's not being taught yet. So if that's the case, whatever the heck it is we're doing now.
It's not being taught in our school, but it is being taught in many schools across the country.
So how exactly does a 5-year-old give affirmative consent?
By saying,
So you are being taught, the 5-year-old is being taught, you know, oh, you have to give affirmative consent to this. So how exactly does that happen when maybe the kids are going to school and maybe they're being shown this stuff and maybe they're being expected? And again, my 11-year-old daughter was told she's not average if she's not having sex twice a week with 2 different people as a STD plan. So how exactly does that happen?
But no, that's a good question. And Dr. Yellen, I think you explained, try again. How does a 5-year-old give consent?
Mm-hmm. Well, can I answer the comment about his 11-year-old daughter not being normal? First of all, that's an extreme fallacy. There have been many studies looking at the age of first sexual intercourse. And even though most of us think that it's happening in 10th grade, 11th grade, it's really not until junior year of high school that the average student becomes sexually active. And that's not to say that if you're a 17-year-old and you're not sexually active, you're not average. That's not at all. That's just saying that if you took 100,000 teenagers and you asked them when they had their first sexual encounter, it's much later than we think. So it's a misconception that, and it's a fallacy if a teacher is saying that you're not average if you're not having sex at 11 twice a week with 2 different people. So,
And consent by a 5-year-old?
So a consent by a 5-year-old is saying, I don't like what you're doing. I remember first hearing about this in terms of, let's say there's an adult who's patting this 5-year-old on the head, patting them saying, oh, you're such a good little kid. Oh, what a cute little kid. That kid can say, please stop touching me on my head. I don't feel comfortable with that. So this is apart from sexual abuse. They have the right to say, I don't like what you're doing. I don't like the way you're touching me, and I don't feel comfortable with that.
What happens if the kid does like it?
That's a question I think we'll leave for another time. With that said, I am certainly getting, it's nice being here with a lot of people. My technical folks are explaining that I've started to go over time. So before we go to our closing, I always want to thank all of our guests, all of our participants for coming to stand here, to take our questions, to get the Grand Inquisition from each of you. Again, I appreciate that, and especially Senator Phil for you traveling out of state, out of city so early this morning to come and visit us. We really thank you for that. With that said, we are now going to go to a 2-minute close. Dr. Gellin, you will start.
Came from out of city as well. I live in Swim.
Okay.
So, yes. Well, thank you again for having me here. And I must say, I forgot to say this at the beginning, that I'm here as a concerned citizen, as a mother, as a pediatrician, as a lover of children. I'm not here as part of any campaign to pass Referendum 90. So, Senator Fortunato, I understand that you're a proponent of providing the American dream to your constituents. I believe the American dream includes being safe from child abuse, not to be a victim of date rape, not to be pressured by peers in society to engage in sexual expression and activity before one is mature morally, mentally, and psychologically. The American dream includes avoiding unintended pregnancy and the risks it imposes on the teen's education, their families, and their economic health. The American dream means having the knowledge and ability to avoid preventable STIs that can lead to sterility, birth defects, and cancer. The American dream means living in a world where people of all races and sexual orientation are accepted. As a pediatrician and a parent and a concerned community member, I will be voting to approve Referendum 90, and I hope you all will too.
So,
Senator Phil.
I agree with everything she just said. The disagreement is how we implement what we're talking about and how we achieve those goals. That's what we're talking about. It's not what the goal is. I agree with everything she just said. It's how do we implement that, and how do these people obtain the American dream as she outlined, which again, I agree with. The problem that we're talking about is how do we address that, and how do we have these people achieve this? And one of the things that we want to talk about, if I could go just slightly off topic a little bit. Years ago, the Department of Health used to publish the abortion statistics. And this was 2000, I think was the last time, 1999. And I actually ran a bill saying that they had to redo that again in publish abortion statistics. 32 abortion failures. Does anybody know what that is? An abortion failure is a kid that they tried to abort that actually lived. 116 women were sterile after having an abortion. What happens if one of those 116 women is your 14-year-old child? So I agree with the need to be educating our children on avoiding pregnancy and sexual education and all that. What we are talking about is how we are doing it and who is supposed to be doing it. That's what we are talking about. All this stuff that's in this curriculum, the school district could be putting that out to parents and saying, you should be discussing this. A parent could look at that, it's perfectly normal book, and say, I'm not showing this to my 5-year-old, but maybe I'm gonna show this to my 14-year-old. Or Princess, boy, I agree with telling our kids, talking about putting toenail polish on, okay? Or another parent would say, I don't agree with that. So if you want to educate our children and you think this is important, you should be sending this information back to the parents and let the parents decide how they're going to do it and what they're going to do age appropriate. I get tired of this stuff where they say some parents won't do it. It's a parent's job to educate their children.
Well, thank you very much. Thank you for both of you.
Thank you.
President Kai, I turn the meeting back over to you.
I would like to thank you all for participating in this PABA meeting. I'd like to thank our speakers today and all the volunteers who made it possible to bring this to you and to record this. And I hope that we will have you with us again next Tuesday at 7:30 a.m. for the next electoral forum meeting of the PABA. Thank
And
you
that will
again.
be the referendums, the next 3 referendums for charter review.
Which will be on the charter review. Yes, thank you very much, Andrew. So with that, stay safe. See you next week, and this meeting is adjourned.